Good morning, everyone.
Morning.
Okay, good morning. Okay, good morning, everyone. Thank you for registering and joining us today for this webinar on strategies for recognizing and responding to student mental health challenges. We are also grateful to have Miss Cindy Wong here with us as our speaker today. Thank you, Miss Cindy Wong, for taking the time to share your expertise. Without further ado, I will pass the virtual mic to Miss Cindy to get us started. Miss Cindy, the floor is yours.
Hello, good morning, everyone. Let me share my screen. Wait for a moment. Everyone can see my slide? Yeah. So
Yes.
I'm using two laptops. So make sure I didn't, because the first time I conduct through online, so make sure I didn't miss out the chat there. Yeah. Hi, good morning, everyone. So I'm a little bit nervous now. Yeah, please forgive me if I'm too nervous. Yeah, wait for a moment. Okay, so everyone is ready? If ready, then we start. How many participants are right now? 20 something. Okay, okay. So for today, we will going to share a little bit about strategy for recognizing and responding to student mental health challenges. So yeah, there's a lot of the engagement lah. I hope everyone can actively unmute yourself, or you can typing, or you can share anything through the chat. So I can see through both laptops, so no worry. Okay, so yeah. Okay, so now we have a ice-breaking activity. Are you all ready? Everyone have your own coffee already, or for the puasa one already? Sahu, right? I think it's almost Hari Raya, yeah. All the best. Okay, so first, my superpower and kryptonite. So now I need to do some small activity with everyone and have a engagement with everyone to knowing each other as well lah. Because I know there's a lot of the participant here. I maybe not really know everyone here, but I hope that we can actively to engage with each other. Okay. So the first thing, superpower. What skill or quality makes you a great educator? Try to think about it. And then second, kryptonite. What drains you or make teaching mentally, emotionally difficult? Maybe you can unmute yourself, share me your superpower and kryptonite, and maybe you can type it out. What is your superpower and kryptonite? Yeah. Maybe I give everyone like 5 minutes. Anyone want to unmute yourself? Is it everyone thinking right now? No response? So for example, my superpower is a great listener. So, or I am a very encouraging and supportive is my superpower. So if I'm a great listener, I create a safe space where students feel comfortable sharing their struggle. If I'm a very encouraging and supportive, I always try to uplift my student and remind them of their potential, even when they doubt themselves. This is my superpower. So for example of kryptonite is more to like, uh, emotionally drained by student struggle. Like, for example, I don't know how to handle their struggle. I don't know how to handle their mental health challenges. Or overwhelmed by the workload, too much work, too much assignment I need to go through, or too much exam paper I need to mark or key in. Yeah, how about you? I saw some response. Okay. Melissa N says, superpower, passionate about sharing my knowledge to students, will go the extra mile to help them learn. Kryptonite, when students are stubborn or go against your instructions that are actually to help them learn. Okay. And statistic, to share my knowledge and skill. K is when learn do not appreciate our intentions. Okay. When learner do not appreciate, okay. Superpower, creative, and kryptonite is like sometimes can't catch student non-verbal cues. Okay. I'm good listener, student not speaking. Okay, so based on Miss Idora and Julian, is more to like when you cannot catch the student non-verbal cues, or like you don't understand them. Okay, in simple ways, like I don't understand them, or they don't have any response to me, or they are not respect, or they are not appreciate what we are trying to provide. Because I know that even though we prepare the slide also take time, right? Okay. Yeah, when sometimes we try to like teach them something, but they are stubborn to learn, or they are stubborn to change, also make us feel like, okay, mainly because of the generation gap for me. Okay, generation gap. Okay, understand. Yeah, the generation is different right now. So for us, even though we need to learn from them as well, learn and grow together. Yeah, I understand. Okay, so next, I want to ask is, yeah, so I need a sharing is like, you already share your superpower in Kryptonite, right? So why did you choose them? Yeah. How you aware that you are good listener, and then how you aware that you are creative? Why you pick them? And like how this really help you support student, and how this affect your ability to present for the student. If like, let's say you mentioned just now, oh, they are not speaking, how it affect you? Melissa say we don't understand the way they think and think. Okay. Student feedback, colleague feedback. So based on the feedback, you found out your superpower and your kryptonite. Okay. How about others? Okay. For second A, make class fun, not boring. Yeah. Make the class fun and not boring. It's the way how you approach the student and make them more focused on your class, right? Anyone want to share or anyone want to unmute yourself to have a sharing? Also can. I worry that I can't detect their problem if I can't read their body language quickly or properly. Okay, okay. Hmm. For Melissa is from personal reflection and what some students say. I'm curious a little bit about Miss Idora sharing. Like, I worry that I can't detect their problem if I can't read their body language quickly or properly. So, what make you feel like you need to detect their problem? Yeah, what made you so worried? Like, if you cannot detect their problem, and then another sharing. For 1B, that my motivations and motivate to teach. Okay. 2A. Enthusiastic to make the teaching and learning more meaningful and relatable to stimulate their critical thinking. Can see that everyone has put a lot of effort to make the class more fun, more engaging and meaningful to attract them, right? Yeah, when we found out that, or based on what you all share, if we really can find our own superpower, it's like our own strength, how are you going to apply this in the classroom or to engage with other people? There was a personal experience in the past that happened. I see, I see. Okay, okay. If there's a chance, we can share more about this. Yeah. Okay, okay. Thank you everyone for the sharing as well. How about others? Do you all have anything want to share? Even though you are not lecturer, even though you're just a support staff and you want to know more or you want to share more, how you're going to uh explore your superpower or kryptonite, even though in the work. Yeah. Sharing to be okay. It's make me wanna Chai teach and end the class fast. Although there is not my intention. Yeah, I understand. I understand. If there is no one to engage or listen or focus, it's really make us feel frustrated, you know. Like now, like no mood to teach already, right? So 2A, help me make the class engaging and fun. My patient in the topic would hopefully be infections. Yeah, to be I may feel demotivated to put my 110% effort because they are not accepting my way. Understand, understand? Yeah. Same, same. I have the same feeling like Lisa as well. Like for me as a counselor, we are focused on the mental health. We do a lot of the mental health awareness event and activity, right? So when they are say like, hey, mental health is not important lah, no need to do this lah, I was like, then I will also feel like, it's like very demotivated to do more event activity. Yeah, I know your feeling. I know your feeling. mm. Any other more before we end our ice breaking? Yeah. Okay. Marisha's interest is also mental health, so I also understand. Yeah, okay, yeah. Okay, we have a sense. Okay, okay. Good luck for your research. Yeah. Mental health. Nowadays, a lot of people talk about mental health, mental health. Last generation, maybe we are not that focused, or maybe we don't have that much information about mental health, or we are not more focused on the mental health lah. But nowadays, the generation is really changed already. All talk about mental health. And then maybe sikit, oh, you trauma me already. Oh, this is my trauma already, you know? And then I always engage with the student, and then I really found that they really know the term so well. Even though I'm a counselor, I seldom to use the term, but they're really good at using the term. Oh, I think I have ADHD. Oh, I have OCD. I was like, oh, how you know about that? But nowadays the information is a lot about mental health. But I'm not encouraged that you all try to do the diagnosis through the online lah. Self-diagnose. It's good that you get the information, but you try to discuss or share with other people to get a more proper information. Yeah. Okay, so thanks for everyone sharing. I like the sharing and to know more about you. So now next, when we talk about to understand or recognize their mental health, first thing, how are we going to empathy or understand their struggle, right? If I don't understand, I just like, even though I tell you, oh, I have anxiety. Oh, anxiety, I know what is anxiety. I have depression. Oh, I know what is depression. But you really understand why is that? Or you really can empathy them when you are facing an anxiety or depression symptom, right? So the first thing is what we need to do is like, we need to becoming the student first. So this is what the topics like, walk in their shoe. So before we want to like spot them to catch them, you want to feel it. You want to understand it. So I have few exercise. Just like 4 scenario, we have an exercise. You try to imagine you are the student. I know that at our generation, classroom, we just go for the classes and done our job, But nowadays, it's different. So the scenario one, Sarah, a 20 years old second year business student, struggle with social anxiety. And then she find class discussion and group work overwhelming because she feel being judged. Before presentations, she experienced racing thought and physical symptoms like sweating and tumbling. She often flees when put on the spot. So this is a social anxiety. Try to imagine if you are Sarah, how do you feel in the class? And what you really wish that your lecturer know when you are struggling with social anxiety, and what kind of the support actually you need. Mm. Can you try to imagine you have social anxiety or anyone actually go through social anxiety? I believe nowadays all of us have have mental health issue, honestly to say. But just like the degree of the serious, like is it some maybe is medium, some is very severe, some is just a very low, you know. Mm. For me, I believe that I have a social anxiety as well. But I think I will very quickly to adapt to that environment. Yeah. So how about you? If you are very introvert and you are having a social anxiety, how you feel when you're in a class? Imagine if you are a lecturer and then you teach how many students in the class. Yeah. If you don't want that too long, you can unmute yourself. Or actually now everyone also anxiety to unmute yourself. Okay, first one, you feel scared. Okay, second, that I'm scared. You want your lecturer know that you are so scared. Okay, the third one, some sort of reassurance, encouragement. Okay, like, oh, no worry, you can do it. Let's try. Mm, maybe allow the student to have a 1-versus-1 session with you first. With me, with counselor, or with lecturer. Okay, Lisa. Okay, you feel nervous. That I'm super nervous with the lecturer. I mean, okay. Lecturer understanding that is a daunting task to present upfront. Support. Okay. Answer to Q2. Hope the lecturer just leave me alone or don't see me at all. Oh, this is very true. Julian Wong. Yes. Hope the lecturer just leave me alone. Yeah. Don't bother me. Leave me alone. I want to run away from the classroom. Okay. Nervous? That I'm not nervous at all. Oh, you wish your lecturer know that you are not nervous at all. Okay. What kind of support? Okay. Encouragement. Oh, Miss Susie, why? Why you want your lecturer know that you are not nervous at all? You try to hide the nervous, is it? Okay. Anxious? Okay. Thinking when back? Okay. Away or notice my fear and rhythm, helping hand. Start with individual, graduate to pairing them small group. Okay. This is what the resources you need. Okay. So far, I don't have students who tell me they are scared. Yes, okay. So for the social anxiety, why they have social anxiety? Actually, this is because there is some negative thought at their mind. They will worry about how other people look at them, how other people judge them. Okay, for example, now I'm present and then I'm very nervous at Tanjong. So I will very stressed. I scared that, everyone is lecturer here. I'm just a counselor. I'm not that good at teaching and this and that. So I will worry like, after I presentation, is it you're going to judge me or you're going to give me a bad feedback? Is it I'm very the worst counselor at the UW? Is it I'm not good enough? Blah blah blah. So this kind of the thought actually like cannot come out the answer. So when the thought cannot come out the answer, then I will feel so anxious. Yeah, so that's why they will start to like thinking a lot. That's why they will have the racing thought. Yeah. Okay. Julian say learning where I can stay hidden. Also with the record video, I could learn at my own pace. Yeah, when the students are very social anxiety, they don't want to interact with other people. They prefer to do the thing alone. When I know that today workshop is only online, wow, I feel I'm so relieved. I don't need to face everyone in physical. I was like, wow, I'm so happy actually. Yeah, to be honest, I'm happy it's online. I can just hide behind the screen. But I know that everyone also hide behind the screen now. It's make sure that everyone is comfortable. Oh, you want face to face? Okay, next time we can do face to face. Yeah, but it's almost holiday. Everyone is stay at home already. Yeah, when the student have social anxiety, how they really feel in the class is like, better I just sit behind at the corner. Don't look at me. Don't ask me the question. So when you are a lecturer, when you try to ask a question, you look at everyone, they don't have any eye contact. You just hide their eye contact or doing a work, very busy. Yeah, just don't ask me to answer any question. Yeah, so actually, what do I wish my lecturer know? I think the very honest answer is like, just leave me alone. Don't call me, don't help me. If the student is not ready to disclose. And then like Miss Susie also mentioned, I want to hide my nervous. I don't want to show my nervous because I don't think it's appropriate to show my nerves in the class setting. Yeah. And then what kind of the support actually do I need? I just really need to leave me alone or run away from the classroom. This is very honest. When they don't know how to cope, when they don't have any resources from other people. Okay. So if the student already have a counseling session, they go through a counseling or they talk to the lecturer, they will more open up. They will like just now mentioned, some students will say, I'm very scared. Yeah, when it's go for the presentation or what. Okay. So yeah, this is anxiety. Thank you for the sharing. Yeah, we try to understand the student first. Next scenario. Second. This is the second one. Just now is the first one. So this is Adam, a final year engineering student, has been struggling with depression. He often feels exhausted and unmotivated, making it hard to attend class or focus on assignment. Even when he does show up, he feels numb and disconnect from the lesson. So just now is social anxiety. Now is depression. Anxiety and depression, the symptom is quite similar, but it's a different thing lah. I believe that everyone in a different life stage will go through some challenges. We go through depression as well. But for ourselves, who have a high resilient, this and that, we can cope and we can came up from the depressed stage. Yeah. But some people, maybe they are not that resilient. They directly fall to the depression stage quite long time. If you feel depressed more than 2 weeks to 1 month, is not okay already. You have to seek help. Yeah. If you feel depressed in 1 or 2 weeks, within this 1 or 2 weeks, and then you try to open up, share, or you try to cope, yeah, that is okay. You will slowly to came out. Yeah. So try to imagine if you have depression and you are a student, final year, FYP, this and that, how you feel in the class. I saw Miss Susie reply just now. The lecturer usually know if their student are nervous. Yeah, if they're very obvious to show the nervous. The lecturer will know. And then when the lecturer asks and I'm not ready to answer them, I'm more scared. And if I have anxiety. Answer Q1, okay? I feel sleepy during the class. Okay. Unmotivated, depressed. Yes, I think feel sleepy is also one of the symptom because maybe you won't sleep well at night or the depression already interrupt your sleep quality. Yeah. If you depressed, how you hope other people know? Not even not really lecturer. How about other people? How you going to tell other people that you have depression? And do you all know how to spot the person who have depression? How to spot? Okay. Like being there is no use and what I'm going through is something not one will understand. My depression, yes, maybe no one understand. Don't know why. I also don't know why I feel sad also if I have depression. That I'm not interested in anything being taught in class. I'm going through something way more difficult to deal with. Okay. Okay, you hope that your lecturer know you are not interested in anything, okay? Hopefully someone realize something is wrong with me and approach me to ask about me or at least show. Okay. Yeah, I think this answer is quite correct. Actually, there is no right or wrong answer lah. Just like more similar to a reality what the student I approach or I engage with lah. Yeah, because some students when they have a depression, they really don't know why they feel sad all the time. Like, okay, their parent is very supportive, their sleeping is good, there's no very any argument with the friends or peer, but they just feel sad. You don't think you can spot anyone with depression? Okay, Miss Susie say, okay. Answer Q2. The lecture is okay. I just don't know what's wrong with me. Someone are good at hiding it. Correct. They are good in hiding it. Yeah. I don't know what support that I need. I just feel lost with the assignment. Yes, correct. When someone is feel depression, it's really like this. Correct. Because they really don't know. Doesn't mean that just now, right? We do the ice breaking, your superpower, your kryptonite. You already try to make fun at the classroom. You try to engage with them. You try to do a lot of effort to deliver a very fun lecture. But some students, they just like cannot enjoy it. They really feel like, oh, no interest. But doesn't mean that you're not doing good. It's really, are they struggling with something? Okay, Miss Adora said a student who just walked out of my class during a test. Oh, then never come back and I panicked and had to get colleague to help find him cause worry what he might do. And finally he was suffering from depression. I see. Okay. So at that moment already burnt out, cannot cope. That's why like work out during the test. Okay, understand. For this experience, maybe it's really traumatized for Miss Idora as well, because we don't know how to handle the situation. What happened will be happen to the student, right? We don't know how to help it out. Okay, it's quite not easy for everyone to experience this as well. Okay, yeah, thank you for all the sharing. It's really true that the depression people will feel like this. But how are we going to spot? This is the question. Like Miss Susie say, we actually cannot spot. Some people is really good at hiding they have depression. If you look at me, do you feel that I have depression? You won't feel that I have depression. But some people even they are very positive, but they have depression. When they're in front of other people, they are okay. They have nothing. But behind the scene, when they're coming back home or they are alone, they feel sad. They are unmotivated. They don't know what they need to do. Yeah, so they feel lost. Oh, thank you. Not depressed at all. Yeah, for me, you look at me, not depressed at all. Even though when I engage with the students, oh, they're happy. Hi, Miss Cindy. Hi, here and there, very fun when we have event activity. But one day they will ask, oh, Miss Cindy, can I talk to you? Can I schedule a counseling session? Oh, in the counseling session only I know actually the student is going through a depression. Yeah, so it's difficult to spot unless we have a open conversation, unless we approach them, unless they open up with us, then only we can know. So it's not easy. Yeah. Yes, I agree. Sometimes the one that laugh are happy also hide a lot of emotions speaking from experience. Correct. This is why sometimes I won't say this is a depression because for me as a counselor, I also cannot do a diagnosis, you have depression or not. But this is how we cope. This is a coping skill, I can say. I go through something, but I know that at this environment, I cannot be sad or what, so I have to be happy or laugh. Yeah, so that's why when we saw someone, we cannot judge that easily in the surface. We need to understand, actually, recently you are quite happy or what, this and that, what you go through. And then slowly open up, then only we know that, oh, you go through this kind of the thing and what kind can support you. Yeah, so have to aware, this is a coping skill or really I hide something. But in the adult world, we know like everyone have stress, everyone have own issue or challenges. So we also need to take care of ourselves. Is it I hide something or I just one of my coping skill? And this is a coping skill. Is it helpful? Is it healthy? Because I believe that the coping skill at one moment is more suitable, is work. But at one moment, this coping skill maybe doesn't work at all. Oh, I try to laugh, I try to hide my emotion, but I still not happy. And then slowly it will burn out. It will overwhelm. There is something wrong. Yeah. So we have to very aware ourselves as well. And then Miss Anwar said this happened when we just came back from online classes during COVID and had face-to-face class. I think maybe the student was around to the change. Yeah, we agree. During the COVID and after the COVID, it changed a lot. And then some, I would say that during the COVID time, for the introvert people, they are very happy. Yeah, no need to face other people. I have social anxiety, no more social anxiety, you know. They just like the lockdown. But for the extrovert person, they very suffer. When finally no more COVID and then we are like no more lockdown, the extrovert people are feeling better, but the introvert people or anxiety people more anxiety because they don't know how to approach people. I really can see the change lah. During that time, I also received a lot of the client for extrovert person, like they cannot connect with friends, they cannot go out, that until they have the suicide thought. Yeah, suicide ideation, like they feel the life is not meaning at all, and then very sad, hopelessness because they can't see the future. Now I looked out at the home, I don't know what I can do. Yeah, okay, so let's go for scenario 3. Thanks for all the sharing. Okay, so this one will be a little bit difficult. A first year communication student struggle to focus and stay organized due to ADHD. Long lecture feel overwhelming and he often lose track of the discussion or forget deadline. Despite trying his best, he finds it hard to stay engaged and absorb information. How do I feel in class? What do I wish my lecturer know? What kind of support do I need? Yeah, ADHD. I think this term is quite familiar or quite well known by these few years because a lot of the student or young adult or adult is like not they have a ADHD. Cannot focus or too hyper. Imagine if you have a ADHD, you cannot focus. How you feel when you're in the class and your lecturer always scold you. Can you focus? Can you quiet? Can you don't interrupt other students? Then actually how you feel. Okay. Rest less. I need break. Reminder, check on student from time to time. Okay. Very frustrated that my struggle may be seen as laziness or procrastinate. Then I have the condition that I have and the lecturer will be more understanding in catering to my way of learning. Lecturer being more attentive to my learning needs and help me cope with study and some information. For the question 1, your lecturers skip you when they know that you are ADHD. Just don't know what to do, okay? And then Q3, I want personal session with my lecturer for every lesson. Okay. Dr. Justina, relax and get bored easily. Pay more attention to them. More hands-on activity. Okay, so you all as a lecturer, you all have any experience deal with the ADHD student? How you all feel when you all deal with the ADHD student? Because I saw some response is mentioned that they need more attention, encouragement, needs more time to check on with them. Actually, this also really tired for you all, right? When you all deal with the ADHD student. I feel very nervous. I don't know how to deal with the student properly. When the student have ADHD, is it? Okay. Have a few students with ADHD in computing. From my experience, we must really be patient with them. But at the same time, the other students also need to be patient with them too. It can be overwhelming for a whole class. Yeah. That's why when I saw the response from you all, I really feel that if I'm a lecturer, I need to pay attention to that student. But also I need to pay attention to another student as well. It's really tired as a lecturer for yourself. Now the session for us is like how we're going to help the student. But from here, we also need to learn how we help ourselves as well. Especially when the other students are grouped with some other student with ADHD, how can we get them to be more supportive to their friends? Yes, this also we will learn later, like about the stigma, integrity and diversity. Yes. Yeah, based on our experience for the ADHD, they also when they know that they have ADHD, they know that they cannot focus, they know that they cannot submit the assignment at the deadline. They don't want to, during the session, they also don't want to be like this, but they like lost control of themselves. It's not like us, today I have to do list 10. I can finish at least 5 or 6. I can on time to submit what the important thing, what is not important thing. We can do that, but for them, it's like quite difficult. They need more time to think. They need more support. They need some encouragement. So slowly, when they know that they have ADHD, but they cannot finish other things like other people, and then they start compare themselves with other people, slowly they will have anxiety and depression. So that's why anxiety and depression is very common symptom, because other mental health issue also cause this anxiety and depressions. Okay, so this ADHD. It's like quite ADHD recently is quite a lot of the students have this kind of the symptom, but I cannot judge like how we going to slowly approach them. They also don't want to be ADHD as well. They hope to be like a normal person in the world, but I can't say that everyone is normal. Everyone will have their own challenges. So I think for the ADHD part, for all the lecturer, is a very challenges student for you all. So it's okay. We understand first. Later we will have another tips. No worry. Okay. Yeah. Thanks for the sharing. So last one, I think is quite common now. So Asha, a second-year law student, struggled to balance her study with family responsibility and financial stress. She often feels emotionally drained, distracted in class, and fall behind due to urgent family matter. So just now is more to like their own personal issue. anxiety, depression, ADHD. So now if the student are struggle with the family responsibility, and then feel emotionally drained, straight in class. So if you facing the same thing, how you feel in the class? Okay, Miss Susie say maybe you can provide a course or training for students on how to handle their peer with ADHD. Yes, yes. Okay, good idea, good idea. I will mark it down. Because some students, when they have a friends who have ADHD, they also don't know how to approach them. But for me to answer this ADHD question, right? For me, I will just perceive them as a normal student, but it's difficult when we need to work as a group to complete the assignment. This is a topic I always discuss with Sammy. Sammy also one of the registered counselor. We also discuss about this. How because some students also facing this kind of the issue and then come for the counseling, we're like, how am I going to help them? Because it's like other students complain about their group mate, and the group mate is like this kind of the symptom, ADHD symptom. And then they're also very frustrated. Yeah. Thank you for the suggestion, Miss Suzy. Yeah. So how about this? When I believe everyone also have this kind of the student, not only busy for their own struggle, also family struggle as well. Very tired and exhausted. Yeah, very tired. Can't focus at the class. And then I need a break and go easy on me. Lecturer can suggest time off or deferment if things get too overwhelming because of family matter. So if you facing we think another way. If you facing a family issue or financial stress, will you open up with your lecturer if you are a student? If you have family issue and financial stress, will you open up or you prefer to hide it by yourself? If my lecturer is the kind, understanding type, I would open up. If she is cool, I will keep it and don't share. Oh, okay. Depend on your lecturer type. But if your lecturer is like she or he is look so cool but a very kind person, will open up. Miss Idora said, oh wow, that I'm feeling overburdened and I can't cope. Yes, the student would want to talk to lecturer and hope they just listen to me without judging me. Yeah, without judging me. Because I think this scenario can be applied to lecture too. Yes, yes, for everyone. That's why I asked the question. If you're facing this kind of the issue, will you disclose to your peer or anyone? But in the normal situation, it's difficult to share. But I believe that, like you say just now, like Melissa said just now, right? If the lecturer or the person are kind, we're willing to share. If they are cool, maybe I won't share anything to burden other people because it is more to personal issue, more to family issue. Okay? Yeah, so I think now we can next because I think this is very how to say It's like when the student open up to us, how we going to empathy them or understand them. Yeah, because there's a lot of the thing we're going through. But when come to communication, we share maybe just a few statements, a few standards, So how we going through the sharing, we empathy and understand them. Yeah, trust. Correct. If you trust the person, then only we can open up. If not, this also slowly you will see the impact. Family issue, slowly the student won't come to the classes, absent, academic performance will be dropped down, and then also depressed, anxiety, like isolation and disconnect from the social or with the lecturer. So this is a scenario, is very simple way to help us to try to think in their perspective if I'm the student. So just a warm-up activity for us. So if my student could tell me one thing, write one sentence that you believe your student wish you know about their mental health struggle. Okay, so based on your experience, right? Did the student come to you and disclose to you that, oh, I have this kind of issue. I have anxiety, depression, blah, blah, blah. What kind of the thing that you wish your student can tell you? Yeah. Like for example, hi, Miss Adola, blah, blah, blah. What is the statement you wish that your student can write to you or say to you or tell you? Maybe I can share a little bit. Yeah, if I have anxiety, I'm not ignoring you. I'm just too overwhelmed to speak. Yeah. Because my brain is too busy to think a lot of the negative thought. And then I cannot focus. If I have depression, some days even getting out of bed feel like climbing a mountain. It's not easy for me to wake up. Yeah, if they can tell us like this, I will more understand them. I will more empathy, right? If ADHD, I want to focus, but my brain won't let me. Yeah, then we know. Next, trauma and family issues. Sometimes my struggle outside of class make it hard to focus inside of class. My mind keep thinking about what happened at outside. Even though the class is fun, is engaging, is meaningful, but I have a lot of the worry, burnout and stress. I'm trying my best, but I feel like I'm constantly falling behind. Yeah, I think that I'm not doing good because I cannot cope, this and that. So low self-esteem. I don't put my hands up because I'm scared of being wrong. Yeah. And if I'm wrong, how other people will going to perceive me, this and that. Yeah, if I have social anxiety, group work is not just uncomfortable for me, it's terrifying, especially when they're asking my opinion, when I put in myself in the spotlight. If they can share this kind of the thing with us, yeah, then we can spot them. We can like, oh, understand that, oh, you are struggling with some challenges. Yeah. So you want the student to tell you this kind of the thing. First, the trust is important. We have to listen. We have to understand. Yeah, the student won't directly come to you then say to you, oh, I have depression, blah, blah, blah. Yeah, unless you already show something and do something, then they feel comfortable, then they will come and disclose to you. Yeah. Okay. Good. So next, I will going to share about the Johari window, a tool for self-awareness and empathy. So this tool is not only for the student and also for yourself, for everyone. So it's developed by psychologists, and this model helps to improve self-awareness, communication, and understanding in interpersonal relationship. Yeah, this is various setting in like education, leadership, and teamwork. So to explore known and hidden aspect of ourselves. This is how we're going to understand a person based on the Johari window. So this is the Johari window. Okay, can see. Okay, my mouse. Okay, so we have 4 area. First one is called open area. Open area is know to self and know to others, which is we know this part of ourselves and other people know about this part of ourselves. So these are our visible character and can include behavior, trend, or quality that we are well known for. So open area is like you can see me. Oh, I'm Cindy, and then yeah, what is my character? Is a happy, joy, and then sometimes nervous. And this is the part that open area I show. I know as well. Other people also know. Okay, this one is a blind spot. Blind spot is know to others, but not know to ourselves. Means like blind spot is I don't know, but other people know. So this is a called blind spot. It's a include quality of behavior that we are unaware. For myself, I'm not aware, but other people already aware. I have this kind of the behavior or character. Okay. So for example, sometimes it's normal lah. Sometimes we gossip a little bit about other people, right? Oh, you know, Cindy is very very like what kind of character, blah 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 like this. And then for me myself, I didn't know about this, but other people already aware. It's called blind spot. Okay. The third one is mask. It's a hidden area, which is I know, but other people don't know. This is what we like conceal from other people and can include quality of behavior that we don't ready to share with other people. I know issue, but I won't share to other people. And this part, last part is unconscious. I don't know, other people don't know. Like which is maybe like untapped potential that has yet to emerge. Okay, so this is a Johari window. So why this is important for us? This is a big picture for us that sometimes we know people in a very surface at the open area. If we didn't have a conversation or engage or talk to other people, we don't know their blind spot, we don't know their mask, we don't know the unconscious part. Yeah, so what we see is very surface and only open area. Okay, so this is how we understand both what student is openly expressed and what they may struggle to review, and then encourage build the trust, and then actively listen and promote self-awareness and recognize how our own strength and blind spot impact student relationship. For me, for ourselves, everyone, we have our own blind spot. I also don't know unless I get the feedback or I talk to other people and they will say, oh, Cindy, actually you are like this, blah, blah, blah. Oh, really? I didn't aware about that. So my blind spot will be like, become not that, I will aware my blind spot and then will become slowly to change to a open area like this. Okay. So for example, if the open area is known to self and other is, for example, a student openly express stress about exam. Oh, everyone know exam is very stressed. So I also very stressed. I tell you, so I'm a student. Okay. So this is the open area. Everyone know I'm stressed. So the blind spot is the student don't know, but you know as a lecturer. Oh, you look at the student, you know already very anxious, already, sweating and then like cannot focus, like already lost, but they didn't know. They still think that, oh, I'm okay. I still self-control. I'm not anxious. And then for the marks, it's like the student know, but other people don't know. The student struggle with family issue, but doesn't share it. Like the scenario just now. I struggle with my own issue, but I didn't share it. So I didn't let other people know, but I know. So the unknown part is like more to like both of us don't know. Yeah. So it's more to like unconscious mind or unresolved trauma affecting their behavior. Like just now the sharing. Oh, even though the person who are very happy, very joyful, they also hide a lot of the emotion. Maybe this is a coping skill, unconsciously coping skill. We don't know. Okay? Okay, so how the Johari window change over time? Okay, so for the open area grows when trust and communication improve. Yeah, so when I live, for example, I'm 20 years old. So I have about open area, I have blind spot, I have mask, and I have unconscious. And slowly I grow up and then I engage with more people. And then they will say, oh, Cindy, actually you are quite responsible. You are okay with this, you are not okay with this. Then the blind spot will be slowly become an open area because the trust and communication improve. The feedback from my friends, from my boss, from my peer. So the blind spots shrink when educator actively or we actively observe and provide feedback. So this feedback is like we provide to other people when they are not aware they have the blind spot. And then the mask diminish when students feel safe to share their struggle. Like for example, the family issue, the thing I want to hide. I have sexual addiction, like this. So they were willing to share, become not to the open area, but at least it's not a must in front you. And then the unknown may be uncovered through deep reflection, support, and guidance. Slowly we talk in the counseling session. When we talk more, we share more, and then we explore more. Then the unconscious will become a conscious mind. So this is how we apply during a counseling session, also to understand the people around us. So you can apply this when you talk to the student, which is what is a more to open area. Like just now the scenario. What information is the open area? What could be in the blind spot? How can educator uncover the mask? What might exist in the unknown area? So always you prepare this kind of the question in your mind, then you know how to explore and interact or communicate with your student. This is how we do a self-awareness and empathy. So before you apply for other people, you have to apply it to yourself as well. What is your open area? What is your blind spot? What is your uncovered mask? What is the unknown area? Everyone have this kind of thing. No worry. We are human. Okay. Okay, next. So first, just now we already go through the how we empathy or understanding the student. Oh, we already understand they have the mental health issue already. But actually, how are we going to spot the sign? How? How? Ready to know? Okay. But the first thing is, how do you recognize your own mental health challenges? Haha. Before you're going to catch other people, how are you going to catch yourself? We just want to know other people, right? For myself, no. But it's important for you to recognize your own mental health challenges before you recognize other people's mental health challenges. If I didn't know my own mental health challenges, how am I going to know about other people's mental health challenges? Right? How do you recognize your own mental health challenges? I believe everyone has go through these, just like how am I going to define or explain how you spot yourself, like already overwhelming, or when do you feel more stressed or overwhelmed? What are your personal insight? Come share with me before we share the tips. We need to exchange information. Take time to think, right? How I going to recognize my own mental health challenges? I hope later I won't receive a feedback like, oh, Cindy actually have to teach us how to spot other people, but they are spotted. When work get overwhelming or personal issue get out of hand, I get angry easily or rush out at people who were at the wrong place at the wrong time. Okay, I understand. When there is too much to do in such a short period of time and almost everything is urgent, can prioritize but still thought to do so. It's more to like too much, too overwhelming. So the warning sign is like get angry, quiet, not talk to other people. For me, right? When do I feel more stressed or overwhelmed? For myself, right? More stress or overwhelmed is when I feel like I cannot handle the task or the job. And then we worry about other people feel disappointed to me. Then I will feel so stressed. When someone or myself have a very high expectation, I will feel so stressed. Mm. And then the warning sign for myself, based on my observation, is we always will look at the positive good, like sometime, to encourage ourselves. Oh, this positive good is very nice, can encourage me. But until one day I feel like I cannot persuade myself to stay motivated. And then I just like very negative. And then I just doubt myself that I'm not doing good enough. Oh, this will be my warning sign. This is how I found that, oh, maybe I burned out already. I have to take care of myself. I have to do something for myself. I always more conscious about the way I think and the way I talk to myself, the way I self-talk. Normally I will do self-talk is a more encouragement and more positive. It's okay, Cindy, you can do it. Try your best. It's okay. You no need to worry about too much, blah, blah, blah. Until one day I cannot persuade myself based on my self-talk, then I know that inner have one voice or one sound is more louder than my self-encouragement. Then I have to be away. I don't want to really engage in conversation with others. Okay. So when you feel so burnt out, then you won't want to talk to anyone. More to keep it by yourself. Like have your own space, right? Okay. So how about other? How you recognize yourself? Very difficult, this question. Oh, actually everyone already disconnect from the laptop. Oh, I cannot see everyone's face. So Miss Susie said because we think about other people more than we think about ourselves. Yes. Mm. So for Miss Susie, the focus is always on the student or other people more than yourself. Okay. Yeah, that's why I would say, the generation is really different from last time and now. Because now the student, right, the young generation, they really focus on themselves. They really always aware their emotions, their thought, their behavior. But for us, right, last time, I think we are just do it lah. It's okay one, no need to worry too much. Just do it. Life still ongoing, There's nothing to worry that much. It's like more harsh lah for the last generation, and then for young generation it's different. Yeah, that's why we didn't always like reflect our own mental health challenges. I'm not sure what do you all think about it, or what is your perspective about this. Oh, good so far. No more sharing. No more sharing. Then next. Okay, Katie say instead of doing anything, I will end up doing nothing and just feel like sleeping. Use the sleeping way to cope. So I guess some of us are immune to stress that we don't know we are stressed. Oh yeah, agree. Yeah, like Miss Susie said, we are really immune. Some people maybe through eating also. If I know that my mental figure open out make me lash out, then I will quickly isolate myself because it's not fair to lash out on other or hurt other when we stress. Agree? My coping mechanism is to go for a run or hike alone. I just need to be alone for a while. Yeah, be alone. Okay, yeah. So this is how we aware our warning sign lah for the burnout. Okay. Good. Thanks for the sharing. At least we can do some self-reflect. Like Miss Susie said, maybe some of us already immune. Yeah. Run out of breath. That another stress. I feed the cat. Okay. Feed the cat. Yeah, actually they say if you have a pet, no matter it's dog or cat, also is one of the therapies for everyone. Yeah. If you have time, please have your own pet. Yeah. Confirm a stress for me. Correct. So everyone can adopt a cat, maybe. Yeah, so recognize mental health changes in student. Let's go to our student. So how can you spot mental health changes in student? Okay, first one, like everyone say, maybe you all will be aware, some is emotional, some is behavior, some is the way I interact with other people. So this is how we aware or spot the mental health changes. I will say that this is very simple and everyone will be aware, but sometimes we overlook, sometimes we miss out, sometimes we just ignore, you know. So change in behavior is very obvious. So suddenly withdraw from the class discussion or social activity, increase irritability, frustrations, or emotional outbursts, explain absentees or frequent late arrive, risky behavior or self-harm. And then emotional part is more to like persistent sadness, tearfulness, or appearing overwhelmed, expression of hopelessness, like nothing is matter, I want to give up, or extremely mood swing, like sometimes it's too happy, sometimes too sad, or too worried, too anxious, or lack of motivation. This is more to emotion. And then we also can focus on the academic performance as a lecturer when we interact with students or you mark their exam paper. So you can see the change from their performance. Yeah, decreased focus, difficult concentrate, or easy to forget something, and then incomplete assignment. Sometimes there is a lot of the students, they cannot complete the assignment on time, don't know what they are doing, and then miss a deadline, and then falling the grade, and lack of motivation or expert despite previous yeah. So this is more to academic part we can observe, like the behavior one. So sometimes students will be complain, oh, I cannot finish this assignment because I have another assignment, blah, 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 too much, this and that. And then physical symptom and complaint is more to like frequent complaint of headache, stomach ache, or body pain, noticeable change in sleep pattern, and then sudden weight loss or gain, or poor personal hygiene, and then social withdrawal and relationship struggle. So avoid a group work or social interaction, increase conflict with peer or sudden change in friend group, and then isolate themselves or spending too much time alone. So this, okay, for some people, when I do the slide, if I not put too much empathy, or I just just observe someone, I will say like, oh, these students are finding excuse to don't want to submit the assignment, don't want to do their work, Yeah, it seems like some people will use this as an excuse. But some people is really struggle with mental health challenges. So maybe you spot in your class 10 people, 10 students in your class. 5 people is using the same reason to have an excuse, but inside the 5 people, I believe that there is one student is really struggle with the mental health challenges. Yeah. Correct, right? Do you all agree with that? But that's why we cannot easily to judge that. Even though this is an excuse, we also need to understand behind the meaning. That's why window Johari is very important. Okay, lack of motivation. This is the information I have. What is the must? What is the blind spot? What is the unconscious part? Let's explore more. Sometimes when we already work at this education field is too long already. Oh, I already know my student pattern, blah, blah, blah. Then this is just an excuse. Means that we already ignore the sign that the student provide to us. Okay, so a small note. So everyone actually express their mental health challenges in different way. Like just now the sharing also, everyone is a different way. Maybe some is just through behavior, and then some is very emotional, some is through the academic, some is physical. So just recognizing the early sign can help provide timely support. So when you all notice like some of this change in behavior, emotional red flag, or even though academic or physical symptoms, social withdrawal, it's okay to approach them. It's okay, just ask more, get more information. Okay, so I already know you have this kind of the issue. So is it I can provide you more support or more resources for you to go through the life changes. If that doesn't seem is like a mental health changes, I will say it's a life changes. In our life, different stage, we will have different changes. I will just perceive maybe one semester, everyone have this semester challenges for themselves. So don't simply ignore this kind of sign, even though it's very easy and simple to catch, Okay. So also very common mental health condition. I don't think I need to explain what is anxiety disorder, depression, but this two is sometimes like often is called as because like for example, the condition is like a circle lah. Like I too worry. If I too worry, then I will lead to the feeling of hopelessness, depressed. I too worry about my future, what I need to do, and then maybe I cannot find a good job. I don't think I will meet a good people. The world is so bad, so there is a lot of the stress, then slowly will become depressed. It's a hopelessness. So nowadays, the anxiety and depression is always like uh together with the student. And then ADHD, and then trauma and PTSD. This is a quite common now for everyone, the student. But the important is support. We no need to diagnose them. Recognize the sign is help you to refer the student for the help. So no matter the student have the anxiety, depression, trauma, PTSD, or ADHD, it's okay. You no need to do diagnose. You just focus that you are just a lecturer. We are not here to diagnose them. You can aware that, oh, this student maybe cannot focus on my classes. What issue he or she have? Maybe I need to talk to them. Maybe I can encourage them, or what kind of the resources I can help them out. But you no need to diagnose. Oh, you have ADHD, then what? No need. Because for our job is not to diagnose. We just want to recognize and then provide what resources for them, and then they can more effectively to engage when you have the class with them. Okay. So next, now we want to know how we can effectively respond. So just now we already focused on how we spotting the sign. So the spotting the mental health changes is more to first thing you need to do a self-reflect for yourself as well. How you observe yourself have this kind of the mental health changes or life changes. Only we know how to apply to observe other people. If I also didn't know how to catch my mental health like stress or the warning sign, then how I going to recognize for other people as well? Okay, so the simple tips for us to recognize their mental health changes is more to like behavior, and then also emotion, physical, academic, and also the social interactions. So just understand these few aspects. I think it's very helpful for everyone already. Because we are not trained in a very professional way to diagnose the person. And the class have a lot of the student for you, 20, 30, 10, It's not easy for you to engage one by one, to understand one by one. If you have a session one by one, it's very tired and overwhelmed as well. But it's just good that you observe and then you catch them, talk to them. Oh, they need a counseling session or other resources, just refer to us. Yeah, refer to the counseling you need. So you are not too overwhelming. You won't feel that you have a lot of the workload, not only the paper, not only the assignment, also the student. So we can work together from here, the counseling and the lecturer. Yeah. Okay. So next we go for how we're going to effectively respond or how we support the student after we catch them. Oh, you have mental health challenges. Next step is how I will respond to them. Breaking the silence, encouraging open conversation about mental health. Okay, so I think nowadays we are quite open to talk about mental health, right? Or for all of you, you still feel like I'm not ready to talk about mental health. I'm okay, I feel good, so you don't need to worry about my mental health issue. For you, if you feel like you are overwhelming, you are stressed, will you open the conversation to talk about your mental health with your peer, with your colleague, with your friends, with your family? Or if you have a mental health changes, will you willing to talk to the counselor as well? Are you ready to talk to the counselor as well? It depends on how open the person is to listen. Interesting. Okay. More sharing. Are you ready to talk? And not want to find solutions, but be supportive and listen. I understand you. I understand you. So I want to ask, right? It depends on how open the person is to listen. If at the moment you really, really need someone to support or listen to you, do you have that person in your contact list? I do have two best friends that I talk to. I do talk to my husband. The two close friends I talk to, it is about my husband. Okay. Thanks for the sharing. Yeah, there's someone you can talk to. Yeah, how about Melissa? Yeah, not many, but at least got one or two. Because right, when you mention it depend on how open the person is to listen, I will perceive it is quite not that proactive. Doesn't mean it's a bad thing. It's more to like I stress, I need someone to talk. But I will depend on the person around me, then I want to talk or not. Yeah, the first thing is we need to find a right person. The second thing is for yourself, your own action is what? If all the time we depend on the situation or the environment, is it you also very suppress to yourself? This is the thing I'm curious about it lah. Yes, I know. That's why you will say depend on that person. Because I have a bad experience last time, so I won't think I want to share anymore because the experience for me is so bad. Same goes to the student. I share with my lecturer last time, but my lecturer response is so so cool and not good at all. So this experience always trauma me to talk to another kind lecturer or who are ready to help. Don't want to be the wrong person. Yeah, we learn from the experience. That's why when I always share with my student also when we have some bad experience and it's quite trauma us, it will limit our behavior in the future to do the same thing. Because I don't want this kind of thing happen again. Yeah, this also one of the anxious thought I can say. It's normal because our own experience, right? It's not a good experience. Unless it's a good experience, I don't mind to do it again in the future, right? Yes, a right person to share it is very important also. So that's why. Yeah, so it's like how we ready to open the conversation about and talk about our mental health. The right person is very important. So now we are trying to not be the right person, but we try to be kind to the person around us. So how we going to open the conversation is like approach with compassion and curiosity, not judgment. Not judgment. When you want to know something, we need to keep our curiosity to ask more. It's not like a gossip mood, Huh? You break up? Why? Not like this. It's like, oh, you break up. Okay, may I know what make this kind of what made you and your boyfriend or girlfriend break up? Can I know more and how I'm going to support you from this? It's not a judgment. Break up again? Why you break up? Oh, is it you are too difficult to deal with? Oh, it's not like this way. Okay. It's a curiosity. It's more to like very empathetic. It's very kind. Okay. It's not like a gossip or judgment one. Use open-ended question to encourage that sharing. Okay. Like just now the example. Oh, can you share more with me? Do you want to talk more with me? It's more to open-ended question. Avoid yes or no question. Because if maybe they will shut down. Just answer yes. You want to eat? Yes. You want to sleep? No. Just like that. And then normalize their feeling. When they share the feeling that I feel so depressed, blah, blah, blah. Oh, that's okay to feel this way, Yeah, it's normal to feel this way when there's too much of the thing you are going on right now. So this is how we, the first thing lah, how we open the conversation. Very basic. But sometimes we forgot to practice this way when we too comfortable to being ourselves, you know? Yeah, too direct already. So the example of the right question, I won't say it's a right or wrong, but just like we can try in different way. So for example, hey, are you okay? Yeah, I'm okay, bye. So no more conversation. So maybe I can try is like, I have noticed that you seem a bit off lately. Do you want to talk about it? Yeah, you want to share more about it? Okay, so why are not you doing your work? It's very judgment, right? Why you don't do your work? Can you faster finish your work? So it's not that kind lah. So maybe another way is I have noticed you having trouble keeping up. So is there anything I can do to help, or you want to let me know what are you going through? So the third one, like, do you need help? No, thank you. I'm good, fine. Bye bye. Yeah. So next one, maybe like can engage the conversation is like, would you like to talk to someone who can support you? Yeah. So maybe I know that I cannot help you out. Maybe I'm not the right person for you to share, but maybe there's someone we offer another resources. We offer another choice to them. Okay. And then next, what's wrong with you? What's wrong with you seems like very judgmental. When someone talk to me like this, what's wrong with you, Cindy? I was like, oh, is it I'm doing something wrong? Is it I'm not good enough? Blah, blah, blah. So I feel scared. So maybe we can try that. Oh, I see that maybe you are struggling and I want to understand how you are feeling. Okay, so you should try to be more positive. Oh, this one. Hey, don't cry anymore. It's okay. No need to depress. You can be positive one. Just smile. Just you need, be positive. Doesn't mean I don't want to be positive, just like it's hard, okay? So it sounds like you are going through a tough time. Would you like to share more about it? Okay, you just need to focus more on your study. No need to be sad, no need to anxious. Focus on your study. It's good enough already. Okay, so maybe try another way. It's like it seems like you are finding things challenges right now. How can I support you? So it's more to it's like not open-ended questions. It's more to open-ended question. It's not like yes, no question. And then it's more to like empathy or can share more. Actually, this you can find through the Google, like how you using the empathy word to talk to other people. When you try to talk in this way, they are more open up. They're willing to share more. Okay. It is not difficult, just sometimes we forgot, right? Okay, so next is just now is more to like how we ask the question, and now next is the active listening skill. What is active listening skill? It's a way how we show students that you are genuinely care and understand their struggle and involve paying attention, reflecting, and responding thoughtfully. So the 4 key component is pay attention, give full attention, maintain eye contact, and note occasionally. Okay, like, okay, I understand, like that. And then reflect and validate. Repeat or paraphrase what they say to show understand. Okay, I noticed that just now you say that you are quite depressed because of blah, 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 due to the family issue, blah, blah, blah. And then you feel like this way, blah, blah, blah. Just like validate that feeling. And then third one, ask clarifying questions. Can you tell me more about what's been going on? Like for example, breakup. Oh, is it you are too difficult to deal with? You no need to answer. You just ask more. Hey, can you tell me more why? What happened? Go through between both of you. And then the last one, provide emotional support. I'm here for you. You don't have to go through this alone. Emotional support is more to like, I know that we cannot do anything for the student or the other people, but I'm ready here to support you if you need any help. If I cannot help that much, but I will try to find out more resources for you. This is called provide emotional support. That's why all the session I will go through you as a person first before you go to help other people. If you are not in a good conditions, how you're going to provide emotional support at that moment when you need your own emotional support as well, right? So self-care is very important. Okay. So actively listening skill. Practice time. It's time to practice. Okay. I just don't care anymore. Okay, from this statement, what you can apply your active listening skill. What you're going to answer when the student to you. I just don't care anymore. What is your answer? Like I said just now, you can reflect, asking a question. Yeah, how you going to answer this? Very randomly. For you, how you're going to paraphrase or respond, react? Few question, practice lah. Or your response, I don't care, I just don't care anymore. And then don't care lah. You jump lah, you go lah. Cannot be like this all. Any other response? Be empathetic, not judgmental. Open-ended question. Not difficult, right? You all really don't care anymore. Or you want me give answer first? No one try? No one try? No one try? So my answer will be, it sounds like you are quite overwhelming or you're feeling overwhelming recently. So can you share with me what been on your mind? What made you feel like you don't care anymore, or what made you feel overwhelming actually? Yeah. So this will be my answer. Or what we can respond or react is like you have to think. What kind of the thing I want to know more? What is the curiosity you have toward this statement, this student? Or actually you don't have any curiosity. I just want to end my class faster. Let me know your thought as well. Everyone good? Everyone okay? Is it too overwhelming for the class? Do let me know your feedback after this. I will improve myself. Yeah. Okay, next have to answer. Try. It's okay. There's not right or wrong answer. Just like how you're going to respond and react. We are here to practice. For me, I also not that good before I become the counselor. I also very stuck when I just don't care anymore. Then I'm like, what I going to answer? I also don't know. I'm like, okay. Yeah, just like don't know how to respond and react. So we just practice together. Okay. I'm so stressed about my exam. I feel like I'm going to fail. Okay, so when someone talk to you like this, a student talk to you like this, how are you going to respond and react? Actually, this is a practice like how we going to open up the conversation when the student have mental health changes. Yeah, if we didn't practice from a small conversation, then it's difficult for us to apply it when in the urgent situations. Everyone good? Okay. Very difficult. Or cannot think what you all want to say. Is it difficult?
Cindy, I think your messages are lagging maybe. Because we can see some responses.
Oh, really?
Yeah.
Eh? Oh, wow. So many suddenly. Wait lah, wait lah. Ah. Oh, finally I saw. I'm sorry you feel this way. Do you want to share about what you feel that way? Oh, finally I saw. It's me lagging. Everything is going, everything is going to be okay. You can talk to me anytime. Mm. This specific that make you feel this way. Yeah. It is okay to feel stressed. Let me know how I can help you cope and support you. Oh, yeah. It's normal to be stressed. What do you think you can do to lessen the stress for yourself? If you don't have any method, perhaps I could help. Yes, exam can be overwhelming. Is there a specific topic that you need more help with? Wow. It's my chat lacking. It's not everyone not responding. Sorry for the misunderstanding. I was thinking, is it my class is too difficult? No way, everyone answer very good. Really can practice. Yeah, correct. Wow, so good, so good. Yeah, nice. Nobody really understand what I'm going through, huh? How are you going to respond and react? So to answer this one, stress about exam, that one, if you are a lecturer, you also can respond in this way if you don't want to like interrupt too much. Maybe you can say, oh, I heard that you're feeling quite anxious for the exam. So have you been able to take a break or talk to someone about this? Like just checking that is it they have some support system to talk to. If they have, yeah, I always talk to my mom, I always talk to my parents, my sibling. Do you feel better after you talk with them? Yeah, I feel more comfortable. Then I will encourage you to have a talk with other people, yeah, to make you feel more uh comfortable or encourage you to more confident during the exam. So you can reduce your stress and have a stable performance during your exam. So if you want to offer the help for yourself, also can. If you want them to like find out their support system, also can. Okay, let me see. Is it my chart ranking again? Can you tell me more? I'm happy to lend my listening ear to try and understand. Yeah, can you tell me more? I can imagine how frustrating it must be feel like that. I'm happy to listen if you need went out. Wow, everyone is offering ears for the student. Yeah. Yes. My answer also like, you are not alone. I'm here to listen from you too. Okay, Miss Susie say, yeah, nobody understand what you are going through. Go for a walk and look at the bird and flower. Is that okay? This okay also, but it's more to a solution. Yeah, it's more to a solution. Because this person mentioned nobody really understand what I'm going through. And then what you can tell is like you want to provide the solution, right? Just like walk around to calm down yourself. Yeah, I understand Miss Susie intention. Yes, not everybody understand us. So first thing we can empathy first. Empathy their feeling, their thought. I understand you. Really, nobody can understand ourselves. Even though for myself, I also not understand me. But my solution to help me to calm down or feel grounded or feel better is to have a look at the outside, go to the natural, look at the bird and the flower, This is my solution. How about you? Yeah, so you can have your own solution, but not need to apply to them. You can ask them, how about you? Do you think this solution is good for you? Yeah. So it's good. The idea is good, just like how we polish the word to the other person. And then Evelyn said, can you tell me exactly how you feel? This one also okay, but a little bit how I feel like nobody understand me. Nobody understand what I'm going through, how I feel. I feel sad. If I say I feel sad, how are you going to explore more? Because no one understand me. Can you put it into simple word as if you were speaking to a kid? Maybe I can help you. Word as if you were speaking to a kid. Do you mean that when I tell you nobody really understand what I'm going through, you are asking me to explain it, like talk to a kid? Put it into simple word. Let me think. I can see that you'll try to explore. Yep. Try to explore more. Why this student or why this person have like say about this statement. Nobody really understand what I'm going through. But for me, I will first focus on the emotion first, because I can see that nobody really understand what I'm going through. At this moment, actually, I'm tired. And then you ask me to change my thought and everything, like speak to the kid, means like I have to ready myself to talk to a kid. So it's also made me tired. So like, nothing lah, it's okay. This will be my response if I role play. Yeah. But I understand you try to explore. Yeah, it's a good try. I understand that nobody understand you. Do you want to write out on a piece of paper? Maybe that would help. Okay, also got solutions. I think it's good like you say, when no one understand me, and then I want to manage my thought and more easy to let other people understand, I will try to write down at the paper. How about you? Do you think this way is helpful for you? Like the last part is quite okay for me and very good. Yeah, this is how I really like to like engage with everyone. Like based on the statement, everyone have different reaction and response. And this is the interesting part. And then this is how we learn from each other. You all can come out a lot of the solution, but is it suitable for that person? We don't know. But at least we try to ask. Like go for the natural thing, you can have a work, and then maybe you can try to speak like a kid. It's more to like how we're going to explore and understand. Yeah. So for me, I also will be focused like the emotion first. Yeah, I know it's very tiring and then no one can understand you at this place. Maybe I believe that you are trying your best to do something, but seems like they are not understand what you're trying to do. So if you're ready, you can talk to me. I'm always here to listen. I'm always here to support. And I really hope that I can understand you because I believe that you are not alone. Because when somebody said really no one understand me is quite a depressed stage, like I can say. It's like hopeless, like no one can be the support system. So we try to be their support system. Okay, next. Everything is just too much. I don't even know where to start. How you all going to support or respond? But I'm confirmed that all the sharing here is not right or wrong answer, just like how we practice together. Everything is just too much. I don't even know where to start. Okay, when you try to speak like this, how you feel? If your colleague talk to you like this, everything is just too much. I don't even know where to start. How you're going to respond to your colleague? Okay, I understand it may feel overwhelming. What's the main feeling that you are feeling now? Or main incident in your mind? Let's start there. Okay. I can see that you try to check in their feeling, just too much, and what you feel when everything is too much. And then what is in your thought? Okay. I would like to know how to answer this as well, because I'm the type of person that will just betray if I have this feeling myself. This is not my sample answer. Just saying this is something I don't know how to answer. Sorry, let me. Um,
Cindy, can you
Yes.
hear me? Oh, sorry, that's not a sample answer to that question. I'm just saying that I don't know how to answer this because if I have the same feeling, I would just
Understand. So
and
you also
retreat.
don't know
Yeah.
answer this. Okay,
Yeah.
okay. Okay. Okay, understand. We would like to share more. We can grab something to drink while you are sharing. Oh, drinking something is good idea. Okay, understand. So, yeah, thanks for everyone for the sharing. I can see that you are trying to like explore more and understand more and apply the active listening skill. Why we call this is an active listening skill, even though just a statement. From that statement, what I listen from the word is how I'm going to reflect and react to that person. Okay, so everything is just too much. I don't even know where to start. So this can be seems like too much workload, maybe too stressed, and then I don't know how to start. I already lost myself. So actually how to answer is like first thing, I can see that maybe you are handle a lot on your plate as well. So let's take this one step at a time. So what's been the most difficult for you? Where to start? Okay, so okay, let's us go through together your mindset. Okay, so from A to Z, what we can help together. Yeah, everything is just too much. Like, it's already overwhelming. So to understand the feeling first. Okay, I understand that. But we not always like, I share one thing. Yeah, I understand the feeling. Yeah, I understand the feeling. Sometimes we can change a little bit, like more humanistic. For example, someone share with me like this segment, everything is just too much. Seems like you feel overwhelming, is it? You can ask the feeling first. Is it you feel overwhelming recently? What made you feel overwhelming? Do you handle too much project? Oh, do you want to share with me? Do you have any support system? Checking in also can in a very empathetic way. Because sometimes like, okay, I understand that it may feel overwhelming. So the first word is correct. Doesn't mean have any issue or problem, but it's how we make it more sincere and humanistic, I can say. Because like everything is just too much. From this statement, we don't have any feeling, right? So I will check the feeling. Is it you feel overwhelming or you feel too stressed recently? Yeah, may I know what is the too much for you? What's the thing you are going through right now? So maybe we can work together and then let's see where we can start. Yeah. Okay, so for your Becky, that one answer also good. I no need to check in your emotion first. Okay, let's go. We have some drink. When we have some drink, maybe we can share more. Also, it's another way. It's like how you're going to find your approach to engage or to engage with the person when they share something with you. So first thing we always remind ourselves, be empathetic, understand their feeling, and then ask the questions, explore, curiosity, this kind of the thing. Okay, understand? Is it complicated? Is it difficult? Yeah. So from the statement, you can see, what kind of the thing they share. Like for example, this one, the second one, I'm so stressed about my exam. I mentioned the stress. Okay, so I empathy you. I know the stress. But this one, everything is just too much. I didn't mention any emotion. Can I check with you? Do you feel stressed or overwhelming? Yeah. Okay. Did I answer everyone's question? It's okay. We are just here to learning. For me, I'm easily to not easy lah. I quite sensitive for other people emotion or the change they have. So I will try to role play their situations. I don't think I'm good enough for this. Everyone else seems to have it together, expect me. For this, how you all going to ask? How you all going to explore? What is your active listening skill? How you apply to this? So from the statement, how you feel, what you can see, and what the question you want to explore, and what the thing you want to ask. What make you think you are incompetent in this? What make you think you are not incompetent in this? Okay. You don't know how to answer this question well enough. Okay, okay. It's okay. No need to answer. There is not right or wrong answer. We all, even though for my answer, maybe not the 100% correct one. It's like just how I want to approach the student the way I have. So for me, because yeah, I learned counseling theory, right? So from here, I already can see the negative thought. So I will go for the thought. Yeah. So your BE also say that what makes you think you are incompetent in this. So it's more to like thought as well. So actually it's like based on our observation, let's identify is a thought, emotions, or behavior thing. Also another way. So I will think, I don't think I'm good enough for this. I don't think I'm good enough for this. So what made you think that you are not good enough for this? So for my answer, I will be very realistic to that person. The student is expressing doubt, right? Yes. It's more to like self-doubt. So for my answer, I will be like, be really realistic. Normal, everyone will have this kind of the self-doubt thought. So I will say, self-esteem issue as well. Yes, correct. Because sometimes we will doubt ourselves. Is it I'm not doing good enough? Even though after the sharing session for this or after the presentation or the workshop, I also will doubt myself. Cindy today, is it doing good enough? It's normal. Yeah, so what I would say is like, yeah, actually it's normal to think that we are not good enough sometimes, but not all the time. I believe that you have your own strength as well. So what made you feel like you are not doing good enough for this? Yeah, can you share with me which part made you feel that you are not doing good enough? Is it something like didn't reach your expectations? So from here, when you start the conversation, the sharing is start already. Yeah, actually, my expectation is blah, blah, blah. I want to achieve this, but I didn't achieve this, blah, 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 you know? Yeah. Then the conversation is start already. Then you start to curious and explore more. When the students start to share more, then you can apply more feeling. That's why you feel so sad when you didn't achieve your expectation. That's why you feel this way. That's why you start to think this way. Yeah. So how are you going to normalize this kind of a thing in our real life? So we cannot say, I don't think I'm good enough for this. Hiya, you think too much lah. No need think too much lah. You already do very well. You know, it's like, it's like, a little bit speechless lah. But how are we going to normalize? I will try to think in my life, I also will have self-doubt. I also feel low self-esteem. And this is normal. So when you open up to me, I will let you know, yeah, this is normal. When I face this kind of the challenges, I have this feeling, I have this kind of the thought. So, but we no need to start here too long time. Let's discuss more how we get out from this kind of the circle. So as a educator, as a counselor, as a helper, it's more to like how we can see the thing different way to bring them to see the different perspective. Yes, sometimes the student just want some word of reassurance or encouragement. Everyone has their own way of doing things and performing tasks. Best not to compare. You have your own journey, so just keep it and keep going and moving forward. Something I would say maybe. More to positive encouragement, no need to compare. And then yeah, just want some students they just lost, you know. I don't know I'm doing this right or wrong. So there's a you can do it, don't worry, you can do it. And then about the comparison thing, I always teach my student compare also very normal. Me also like to compare other people, or other people also like to compare with me or other people. But there is a two comparison. Is it a healthy comparison or not healthy comparison? If I do the comparison with other people, oh, this make me feel so anxious. I'm not good enough. I cannot like other people. They are doing so well. This comparison make me feel negative. So this is a not helpful comparison. But the comparison is like, wow, they are doing so good. I want to learn from them. This very motivated me. I want to do this. I want to do that. I want to be like them. They are my role model. So this comparison is a healthy comparison. It's motivated you. So you have to see the comparison is motivated you or demotivated you. So then you can encourage the student what they can do next. Okay? Small tip, small tip. Last, okay. Then we can go for another session. I just don't feel like talking to anyone lately. Oh, this person. I always tell the student to compare with the OU. Oh yeah, with the OU also very good. You already improved. You are keep going as well. I just don't feel like talking to anyone lately. This person don't want to talk. How you going to ask them to talk? I just don't feel like talking to anyone lately. Anyone want to try? Make sure my chat is not lagging. Difficult? Try, it's okay. Sometimes you also feel like you don't know what is the best thing to say. It's okay to have some alone time to yourself. But when things get overwhelming, to reach out to someone. Okay. Agree. Yeah, sometimes we also feel this way. Yeah, any other more? You have just opened the door to some chat. Let's have a coffee. Coffee again. So if there's a lot of the 10 students want to talk to you in one day, then you have to drink 10 coffee. Sorry, just a kidding. But it's a good choice. Food may be a good door open. Yeah, correct. Sometimes we like to hang out. Correct, student love free food. SSC always provide free food for the student. We are so poor right now. It's okay to feel that way at time. I'm contactable when you are ready to open up. Ooh, amazing. Yeah, actually, I just don't feel like talking to anyone lately. So this maybe we no need like have a lot of the keep asking, why you feel like this? Just talk, it's okay. I'm here for you. This also make them to feel very stressed. Yeah, if they don't want to talk. So sometimes we can provide a space for them to have a alone time, like Melissa said, when I want to stay alone, and that's okay. So it's okay, like I say, I get that. Sometimes we all need some space. So, but if you want to talk to me, you always can reach out to me. I'm ready and I'm here to listen. Yeah, so just provide a space for them, and then we are ready to listen if they need someone to. So sometimes when somebody say something, oh, they need some emotional support, empathy, understanding, and some question, self-reflect. But some people they just need to be quiet, stay alone, but always let them know that I'm your support system. You no need to go through it alone. You can always reach out to me. I'm reachable. Okay? Yeah. So thank you for all the sharing. Next, the do and don'ts for support the student. So create a safe and non-judgmental space is very important for the conversation and show empathy and patience. So mental health struggle is actually take time. It's not easy. For me, when I counseling the student who have depression, anxiety, also not a 1 or 2 session can be settled. It's really take time. Maybe they have already 10 session, 20 session. I have one student at UW since 2022 until now. We already have like 50 until 60 session already. The students still come to me to talk to. Yeah, so it's really take time. More to depression and trauma. And then use active listening technique like eye contact, paraphrasing, open-ended question like we practiced just now. And then encourage professional support if you feel like, oh, I cannot support the student anymore. I need someone to help me out. Yeah, always can reach out to the professional and then follow up and check in on their well-being. Hey, so far, how are you doing recently? Are you okay with that? Yeah. And then dawn is dismiss their feeling. Everyone saying, they just say, oh, you will be fine, it's okay, be positive. Yeah. And then jump into problem solving mode. It really depends on the person. If the person is very directly come to you, oh, I have this kind of issue, please help me settle, then problem solving mood is okay. If the person need more to emotional support, then you don't directly throw the problem solving mood. Yeah, so it's really depend on the student what they really want. If the student want problem solving, and then you just, oh, how you feel recently? Are you okay with that? Blah blah blah. And then one circle, the student also very frustrated, right? So it's really depend on what the student needs. So we always ask, what I can support you. When I ask this way, I have a more clear goal, and we know how we're going to settle the issue. And then don't compare their struggle with other. You see other also go through this depression, they're really okay. They are more worse. This is no good, no good. Okay. Push them to talk. Yeah, no need. We can respect their comfort level. Okay. And then also some crisis and non-crisis situation. So crisis is more to an immediate danger, like already have you found out that they already shared with you, I want to suicide, I have self-harm, extremely distressed, try to self or others. So how you're going to respond is like stay with the student, talk to them, empathy them, and then at the same time you faster call professional help for the immediately, and then ensure their safety as well. For the non-crisis, it's more to need support, like anxiety, stress, sadness, lack of motivation, academic struggle. So listen and validate their feeling, offer resources, encourage seeking help. Okay, it's like how we practice lah. So educator, so for all of us are not a therapist, but we play a very crucial role to identify when a student needs urgent or ongoing support. Okay, so why we have this kind of the workshop is more to identify their mental health issue and then how we're going to respond and react. Not only we recognize, but we don't know how to respond and react. So we won't make the situation more worse. Okay? Yeah, next. Creating a mental health classroom strategy for a supportive environment. Maybe we take a break for 10 minutes. We come back at 11:25. Can? Okay. Take a break. Take a break. Yeah. Let me
No, 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 no. Cancel. And stop. Maybe.
Which? That one. The book. Yeah, I lost and then. But try again.
Ta-da, I'm back. You got 1 minute, it's okay. Take your time. Yeah, we still have, I think around 12:50 we can end already. Yeah. If we have physical workshop, I think I will prepare more game and activity to have more engagement. But online, not that much lah. But I'm still happy that everyone's still actively to share. Okay. Everyone is ready? Ready, then let me know and we can start. Yeah. Okay. Yep. So just now what we learned is we already try to learn about empathy to understand other people. Thank you for the response. And then we also like learn how to recognize their mental health changes. And then also how we after recognize how we're going to respond. And then now it's like how we're going to create a mental health classroom, the strategy for a supportive environment. Okay, before we start this, right? We try to think about it. Supportive environment. Not only for the classroom, when you at your own house with your family, with your friends, with your colleague at the office, do you feel the supportive environment as well? And if yes, who create this supportive environment for you? Or is you provide this supportive environment to them? So actually the supportive environment for the classroom setting, when we want to do this, you as an educator want to provide a supportive environment. Let's try to think, do you receive this environment before? Or you create this environment before? Not in the classroom, but with the people around you. When I prepare this slide, I will try to think about like, if I want to have a supportive environment in the classroom, then how if I try to imagine this like my house? Did I have a supportive environment at my house as well? Okay, just think, no worry. Okay, next. What student behavior frustrated you the most when you try to create a classroom environment which is very supportive? Before we create, let's identify what the behavior frustrated you the most. If I'm not mistaken, just now we did mention about the student is not responding, like they're not focused, they not appreciate, right? Anything else? You as an educator, what made you feel so frustrated sometimes in the class? Because I'm not teaching, so I don't have that much experience like how their behavior frustrates me. It's more to like no response because I handle event activity ma, and I asked for the document. Hey, your document haven't submit your financial report. They didn't respond to me, also being frustrated. They asked a question that I already answered for another student. Means they would not listen early. You need to repeat. Okay. When they keep looking at their cell phone. Correct. I am here teaching and you're playing your phone. Not respect. Okay. Talking in class. Oh, this one I experienced before. When the student, not me lah, not me talking, but other student talking, and then the lecturer say, maybe you talk in front me lah. You replace me lah. You talk more than me. I think you can teach. I was like, I was so very scared, so I didn't dare to talk anything. Having a blank expressions, even for simple tasks. She's on the line, please. Or don't respect other students in class, like group presentation of other. Yes. Correct. So this is more to their behavior, right? So when this kind of the thing happen, usually what you do? Score them, ask them to be respect, or what else? Ignore? Ignore us outside the classroom. Very sad, right, Miss Lee? When they are ignoring us when they're outside. Yeah, I can feel you. Sometimes I just say hi, sir or madam or what also can, right? Like they pretend like we don't know each other, also feel sad. This is my first instance when I scold the student but explain to them why I was angry with their action. Okay. Anything else you also would do? I create a job first. Then I ask if another student can answer the question I already answered. Oh, then the student need to answer also very stressed. But it's okay. It's time. It's a process for them to learn. Okay. Yeah, so I think that every lecturer here already have your own style when you're teaching, when you approach the student, when you engage the student. So you already have your own style and your own technique, right? So yeah, it's good. At least we know how to handle. So go back to open conversation about mental health. No, I mean the student who asked the question first, since I already give the answer. Yeah. Okay, understand. Okay, open conversation about mental health. So why open conversation about mental health matter? This help us to understand the important. So just now we learned how to open. Now we learn why we need to open. Because sometimes we just think, oh, I'm just a lecturer, why I need to care about this? It's not my task also. But sometimes it is also important task for us to normalize the mental health discussion in the classroom. If I didn't say anything about mental health in the classroom, so at the Asian country, is it we also not that okay to disclose I have mental health issues. So we just want to normalizing. Doesn't mean that we need you as a lecturer to support them a lot. No need. Maybe just support them, and then understand, and then bring them to a professional. That's good enough already. Yeah. So no need to worry, oh, I need to handle too much. Okay. So the student often feel unheard. That's why we need this kind of the thing at the classroom. They can willing to share and talk. So it's like creating a space where they can express struggle, help them feel valued. And then second, reduce the fear and stigma. If mental health is a normal topic, students are more likely to seek help. Based on my observation and interaction with the student, some of them They are very open to talk about their mental health. They're willing to share. They are okay to find a counselor. But when I ask them, did your parents know about this? No, they don't know. They're not allowed me to see the counselor. They don't think I have mental health issue. Yeah, so this will block them to share more. If you are the parents, do you think that it's good for your child, like, to hide something from you? We also don't want, right? We want them, hey, just open and tell me so how I can help. So for them, I feel it's so sad if I at the family, at the house, I also cannot get the support, you know. It's not easy for me to go through. So I have to seek support from outside. Sometimes the family support is more stronger than the outside support. Okay, so to reduce the fear and stigma, if the lecturer willing to share about a mental health thing, this and that, so they will say, oh, actually it's quite normal for everyone. Okay, and then prevent escalation. Yeah, spotting early warning sign can prevent severe mental health crisis. Okay, so how to encourage open conversation? So in the classroom, ask the student how they feel on the scale of 1 to 10. For example, when the student come for the counseling session, I will ask, hey, how are you today? To feel happy, 1 to 10, how you're going to let me know what is your point. Yeah, use I statement. For example, I have noticed you seem stressed instead of why are you so moody? Yeah, like that. Oh. I have few students for whom parents are dismissive for the student different. Yeah, correct. It's quite difficult when the parents also ignore this. Correct. So that's why we need to doesn't mean that we need to change or what, but it's like I would say it's a process for us to learn because I feel like we at the middle for the generation change. So we have to understand the last generation. We also need to understand the new generation. Yeah, so we like a middle person. Doesn't mean that the old generation or the new generation who are right or wrong. No, just the thing is different. So we'll have different perspective and come out different thing. And then model vulnerability is like more to share small personal challenges. Yeah, so for example, in the class, oh, last time when I exam, I also feel so stressed and panic, you know, and no one can understand the time how stressed we are. So it's like encourage for the openness. And then over anonymous outlets like suggest online feedback form or a suggestion box, it is like more to the anything else you all can do. Yeah, what kind of the idea you all want to provide for the student to open the conversations, and then incorporate mental health moments like you quick breathing exercise before tests or discussions, or sometimes you can have a very fun activity before starting the class if you have the time lah. Yeah, it's not compulsory, but it's more to like how you're going to apply. So I have one test, it's called the person in the ring. So ask all the students draw a person in the ring. So from here we will do the how to say interpretations, how you manage the stress through the arts words. Yeah. Suggestion file is also good for the lecturer. Yes, please. So it's like more small game, and then also you all can get a stress ball, and then you can before start the class. Okay, pass the stress ball when play the music. Pass. When the music stop, okay, the person who hold the stress ball have to share what kind of the stress you have and what is your coping skill. Okay, and then next person pass again to get the stress ball. So this is like the classroom student also learn from each other. Oh, you have stress in this way, and then how you cope with that. And then I have this stress, but I don't know how to cope. So other people can suggest and can empathy, can understand them. So it's like how we build a more encouraging and positive classroom for the student. Just a small game and activity. Yeah. Okay. And to open up. So also to understand the stigma and its impact. So why we have this stigma? So stigma is more to like a negative attitude toward mental health struggle. Like I say, some parents are not ready to accept their child have mental health issue. I have one client before at UW Malaysia also. The student parents is a psychologist. And then they didn't, how to say, they deny their child have depression. I was like, how, why? You study psychology, but why you want to deny your child have depression? And nowadays, anxiety, depression is very normal. Yeah, it's like, actually the classroom setting, the positive environment, is like I as a parent, how I provide a positive environment for my kids as well. And then also I as a kid, how my parent provide a positive and encouragement environment for me as well. It's not only me to provide, but I also the one who receive and provide. Okay, so I will always think in different perspective, like not only for the classroom, not only the task, and how actually this kind of the thing will apply in our daily life. So I need to observe, I need to understand. Is it I get enough support for myself, my environment? So from here, I learn and apply to my classroom. Yeah, so it's not only the one thing lah. Okay, so how does stigma affect the student? So they will fear about the judgment. So they won't ask for the help. If I say that I have depression, maybe they would think that I'm not depression. They will say I'm just lazy. I don't want to do work, this and that. So they will prefer isolate themselves. Better don't tell other people, and then increase the stress. So the performance will be like drop. So it's like a circle, everything. So you, everyone play a crucial roles, and then your words and your action can either reduce and reinforce the stigma. So it's like how we practice just now. Okay. And then, yeah, this is the thing that integrity and diversity in mental health. Just now, the first question about the ADHD. That's why I say integrity and diversity in mental health also very important. And how we accept and understand other people also very important. Yeah, what is integrity? Actually, is like being honest, fair, and consistent in action and decision. So in a mentally health classroom, integrity involve treating all students with fairness and respect, regardless of their struggle, and then creating a safe and non-judgmental environment for the student to share concern, keeping student information private unless sharing is necessary for their safety, following through on permission. If you say you will help, then take action. Yeah, this one is very important because some student, their expectation, when you say, oh, I will be here and helping you out, then they will have some expectation to you. They will say, okay, so this lecturer I can rely on, I can depend on, I can talk to. But sometimes when you are too busy, right, we cannot take care of everyone. So we can say, oh, sorry, at this moment I'm quite busy, but I want to contact you again, or I want to talk to you again when we schedule a time. Maybe not now, but we schedule a time. Okay, so example, if the students share that they are struggling, we should uphold their integrity, but not dismissing their concern, but by listening and providing support. And then one more thing also, keeping the student information private. Sometimes we will unaware to share, yesterday who meet me say share ADHD, so everyone please be careful, blah, blah, blah. This is not good. We need to be, make sure that their information is private unless they allow you to share for other people. Okay. And then what is diversity? Diversity we refer to acknowledging and respecting different among students, include like culture and region background. Yeah, sometimes the culture and region background different, they will view the mental health differently. Yeah, they will say some regions say, oh, this mental health actually is not that important, blah, blah, blah. Yeah, and then personality type also. Some students may be introvert and struggle to express emotion. They want to share, but then they're too shy to share sometimes. Yeah. And then neurodiversity is like more to like ADHD, autism. Yeah. And then personal circumstance is more to like financial, family, or PTSD. Yeah. So a diverse classroom approach means offering multiple way for students to express themselves. Some may prefer writing or over speaking, while others might need extra support due to language barrier or learning difficulties. So yeah, it's another task for the lecturer, but sometimes different approach, different way also provide them another way to share. Okay, so this is integrity and diversity lah. So how to foster this? It's more to like recognize that mental health changes. Actually, it's a lot different. Like I mentioned just now, maybe some is through behavior, some is through emotion. It's different. And then some may just hide it. We don't know, right? And then respect their culture perspective. And then provide flexible learning option. Okay, so someone, if you don't want to unmute yourself, then you can write it down. You can typing. You can. If you want to unmute, then you just unmute. Yeah, so just be flexible and then encourage peer support. Actually, I understand that the group assignment is a good thing for them to have a peer support for each other to complete the task. But sometimes there's a lot of the drama and issue happen during the group assignment. Yeah, but it's okay. It's a learning process for them. It's a learning process for us as well. How to deal with this kind of the issue. Okay, why is matter in mental health classroom? So it's the same thing. Let them to feel safe, value, and respect, and then encourage open the conversations without fear or discriminations, and then build a trust and strong relationship between student and educator, and help reduce the stigma. Okay, so yeah, what kind of the classroom environment you are going to build or provide to the student? This is very important to ask yourself. For me, I will try to think about the way I respond and react, and then how I provide the support, what kind of the resources I have. Yeah. It's more to like I said just now, it's more to self-reflect how my real life, my own life, and how I'm going to apply in a different way. Yeah, that's it for the classroom. Any questions so far? Or do you think like, oh, anything I can add more in my classroom? No? All good? Actually, I believe every lecturer here, yeah, every lecturer have your own style already. Just like sometimes how I going to polish it to more supportive. Yeah, doesn't mean you are not doing good job. No. Just like everyone have a own style. Yeah, and then how I going to make my style more approachable for other people. It's sure a lot to digest. Too much. I still feel that I prepare not enough. I feel the same way. Okay. Just need time to that. Okay. Okay. I still think I was thinking when I prepared the slide, like, is it enough for them? Or should I add more? But I didn't put that much theory because theory is for us to understand, but not that practical. Yeah. Let me know if you all need any information. Okay. Okay. So next, go back to yourself again. Educator well-being, stress management, and self-care technique. Yeah. So like I say, I know that everyone is here to support other people. I know that you all are the frontliner to engage with the student, to interact with the student, to catch their mental health issue, and then refer to the counselor. And then I also know that you are very stressed for the workload, task, this and that. A lot of the things need to do. So for yourself, you all need to handle the stress as well, and how you handle the self-care also. So I also focus some part for you all, prioritize the well-being to support others. So you can't pour from an empty cup if you are your situation or your condition is not good enough. You cannot catch other people mental health issue. You cannot provide support. You cannot empathy them because you are too much. You are too overwhelming. You are too stressed. Understand? Because we are as a human, as a counselor, I also will feel stressed, Sometimes we go through a lot of the session, we help them to handle too much of a negativity thing. So we also need a break. Yeah, so it's normal. For lecturer also, especially when we keep interact with the people. Got people, place, they got drama, they got issue, then we need to handle and settle, right? So what is the link between educator well-being and student success? How you all link? Why? Why your well-being is important for the student success? As a lecturer, you will ask your student, oh, if you have something, you have to talk to someone, you have to go for your counselor. For you, will you go for the counselor? Are you ready to meet your counselor as well? Or actually, you all also very scared about to talk to a counselor. Let me know what made you feel so scared to talk to a counselor. Oh, my China student told me once in class, if the lecturer look uninterested, he also feel like that. So it's a reflection of this on them. Yep, I will say yes. It's like, for my perspective lah, I'm not sure how you all think about it. We are deal with people, so I quite believe that my conditions or other people condition will interrupt me, or I will interrupt other people, or affect other people, or other people affect me. So, but this statement can be explored more, like what of the thing that look uninterested is more to prefer the appearance or the teaching style or the class, or I mean the syllabus or the topic or the subject or what. Yeah, can be explored more, because like uninterested can be a lot of the parts. I would like to explore more and understand more. Because I just directly based on this statement, I cannot judge it what kind of the uninterested. Yeah. Mainly the actual teaching and interaction is what he's mean. The teaching style and the way interaction. Okay, understand. Then from here can be explore more with the student, is like, oh, what kind of the teaching style or interaction they more like? They prefer of what kind of the style? What is the expectation? So from here we can adjust is the student expectation and my teaching style. Is it in the same space or have a very far expectation? Sometimes we cannot I will try to adjust their expectation because I expect that you can teach me in a more fun, more creative way, but the subject is theory, how to make it more fun and more creative way, and then I still have a lot of workload. So from here we adjust, okay, what kind of the expectation you have, and then actually for this topic is quite boring, and then to understand. So my style and the expectation can be in the same space. Never talked to a counselor before, so it's not sure how a counselor could really help. Maybe it's a culture thing in Malaysia. Yes. Sometimes they also have a stigma or discrimination for the counselor as well. Like for example, counselor job is very easy. Just talk to people. It's not easy, as a counselor. I want to complain a little bit. No lah. Because when we are talking, like the statement, when you throw me a statement, I will start to think. I will start to apply my theory. I will start to explore more. So for our brain is very tired. That's why we cannot have a continuous session. We need to have a break. After one session, we need to break, and then we need to drop down all the case note, this and that. Yeah. So never talked to a counselor before. It's okay. You can try experience it. But it's good. But it's good if you feel that no need the counselor help. It means that when you have a life challenges, there is a lot of the support system for you to look for. It's a good thing. It's a good thing. Yeah. So actually what counselor will help inside the counseling session is understand you as a person, understand why you have this kind of the coping skill, understand why you have this kind of the mental health changes, and then what kind of the thing we can do and what is the coping skill we can add on. Sometimes I would say the coping skill is very important in a counseling session. Okay, when I was young and I was a kid, this coping skill is helpful. When I cry, then I can get something I want. It's a coping skill. But if I get older, if I cry, can I get something I want? No, no one will lie on me at all. Ah, Cindy cry again. Don't know why she cry again. Right? So this coping skill is not helpful. So when this coping skill is not helpful, then my life like keep going, feel stuck. Okay, so when I feel stuck, I don't know what to do. When I don't know how to add on my coping skill. So counselor will be here to see the different perspective, bring you for a different perspective, and then help you to add on more coping skill. Yeah, this is how usually we help lah. So at Malaysia, we have 3 things: counselor, clinical psychologist, and psychiatric. So when you want to refer a student, it's good to refer to a counselor first. So the counselor can have a talk to understand the student condition and also your condition. Then only we go for, I feel like, oh, maybe you have depression and anxiety, but counselor cannot do a diagnosis. We will spot the symptom and then we will encourage you go for a assessment. So maybe the clinical psychologist can provide assessment, more accurate. Then if the result is very severe and very dangerous already, you need to have a medication, then you have to go to psychiatric. But when they don't know, the student don't know, they will directly go to a psychiatrist. Oh, I think I have mental health issue. I need to meet a doctor. I need to take a medication. So they will directly go to a psychiatric. Yeah, it's good. The doctor will listen and then provide a medicine for you. But you take the medicine, but the problem's still there. You haven't solved the problem. Maybe the problem is more to relationship issue, family issue, financial issue. You eat the medicine, just make you feel calm, but the problem's still there. Yeah, so no matter how, the psychiatrist also will encourage you go to meet a counselor to talk to. Yeah, so this is how we work lah. Okay. So your well-being is very important. If you didn't take care of yourself, then it's like quite difficult for you to support other students as well. So if you really prepare well for yourself, you also, so my approach is always, I try different coping skill for myself, then only I will encourage students to try different coping skill in their life. Yeah, if I didn't go through that part, it's also difficult for me to persuade them to try it out. For example, everyone have negative thought. If I didn't try to beat my negative thought, and then I just tell you, oh, you have negative thought. Oh, no worry, you can do it. You can do it. And then how I can do it if I didn't experience it? So as an educator, lecturer, or everyone, if I want to say something or persuade something or want to share something for other people, I will make sure that I go through this before and I really can make it. So I believe that you also can make it. So this is how we interact with the student. Okay, let me see. Let me see. Got so basically he find the lecturer have very good lah. Okay. He was comparing to this former teacher in China. Oh, health is well. We need to be mentally, physically, and emotionally fit first before we can teach. Yes, agree. Yeah, thank you, Miss Idora. I second that. Yeah. I also feel that we have a few colleagues we are already close to and we tend to ask for help and advice from them. Yes. Sometimes when we have a positive environment at the workplace, also very good. We can support each other. Okay. How stress impact teaching effectively and personal life? Yeah, right. See. every time when we want to help other people, that's why when I go for the counseling classes, you know, the first thing we need to do is we are not be the counselor first. The first session is we have to be the client. We have to understand ourselves first. We have to settle our own issue first before we become a counselor. Of course, the life keep going on. Our issue is never ended. So it's a learning process for everyone. So when you feel stressed, like just now the sharing, I can see that it's like I will lash out, I will angry. So maybe I will unconsciously, unaware, and then I angry with my student, right? So I think this is a good for you all to keep reflect for yourself. Okay. Yes. Next, common stressor for educator. Yeah, that's why I really understand you all as a lecturer. Sometimes we burn out, heavy workload, emotional fatigue, and then work-life balance struggle. Anything else? When I prepare the slide or ask a lecturer to do this, do that, wow, it's not easy because I know I go through the process, it's not easy, and I add on a workload for lecturer. Is it? I'm so bad. Yeah. But it's okay. You all to just spot the student have mental health issue and then just refer to me. Yeah, I'm always happy to engage with you all. Yeah, refer a student to me. So have to identify your stressor as well. Personal health issue can also affect us. Yes, correct. I agree. Last year, December, I also go through a back pain. Wow, cannot work directly. Have to lie down at the bed, you know. So sad. So we have to take care of ourselves emotionally, physically, mentally. So I hope everyone can take care of yourself. Okay, so self-care tips. I believe that everyone have your own self-care tip. If you feel like the self-care tips is not working at all or how, you always feel free to talk to me, you know. We can find out together. We can explore more. Yeah, so the important part is a set boundary. So as a counselor or lecturer, I believe that sometimes students just text us at the midnight or find us anytime, didn't set any appointment. So it's good that you can set a boundary for yourself because sometimes I believe that you just need a time to like taking care of yourself or you just need a break from the student, from the people, right? So set boundary is good. And then do some relaxation activity. What kind of thing you make you feel relaxed? To be honest, mindfulness is not helpful for me. To be honest, yeah, mindfulness is not helpful for me, but doesn't mean that it's not not helpful for other people. Some people they like mindfulness. Meditations for me is not this kind of the time. I will prefer listen to music or do something I really like or deep breath and then have a short walk and walk around, you know. Okay, and then healthy habits. Yeah, make sure your sleep quality is good and then you keep enough nutrition and then have some physical activity. And then also, please don't hesitate to seek support as well from your peer, mentor, or even though a counselor when needed. If you all need a counselor information, can ask for me. Even though you don't want to talk to me, you can talk to other counselor. We have a lot of counselor. Make sure you find the counselor is a registered counselor. Okay. And then find joy in teaching. This is a very important one. Focus on positive student interaction and small wins. So even though a student struggle with mental health, but they also can achieve some small step, just celebrate the small wins. So this will encourage them or also encourage you achieve a small thing in their life, you know? Yeah. Okay. Yes. Conclusion. Finally. So recap what we learned today. Empathy. Yes. We try to understand first and then foster the connection first before we try to help them. Want to understand why you feel depressed, why you feel anxious, and then spotting the sign. Okay, recognize their emotion, behavior, and physical distress early. And then how to support, more to like listen and ask the right questions, okay, and respond with care. And then the third one will be create a supportive environment. This supportive environment, I hope that not only for your classroom, also for yourself. And then your self-care is very important. Without you, the student also cannot learn from you. So you are the role model for every student. So small step is a big impact. Let's continue create a safe and supportive learning space together. Okay? Yeah. Personal action plan. This is a one small homework for everyone. What is one change you will make after the workshop? Okay? Just think about it for yourself, for your student, for the classroom, or anything. Yeah. Okay. Any Q&A session? All good so far? Can catch up? I hope this information is simple but a little bit helpful for everyone. I have a thought. Nowadays, the issue with student I feel is we don't know how to distinguish between if it is a mental health problem or an attitude. True. Yeah lah. But I will perceive it attitude problem also because of the mental health problem. The attitude problem, I will see, okay, let you all have a visual like this. Everyone is a tree, pokok. So, what you all can see the attitude is the leaf, This is the thing we can see. But the downstairs, we can't see. There is an unconscious mind, unconscious thing, unconscious emotions. So when you spot they have attitude problem, after explore, then you will find out that actually they have mental health struggle as well. Because recently I also have the client, like for example, sexual addicted, also a attitude problem, also a behavior issue, so also related to mental health. And then some students, they want to stole something. This also a attitude problem, but also mental health. Yeah. So if you have a kid or you have a student, they have attitude problem, try explore more. Why you have this kind of the attitude? Then you will know more. Yes. Open mind and be understanding. Correct. Thank you everyone. Thank you for joining my workshop. I hope to hear from your feedbacks too. Yeah. Anything can let me know. I will improve. Thank you so much. And happy holiday, everyone. Thank you. Hope you all enjoy. You too. Take care. Take care.